So let's talk about where in the squat you might be first noticing the pain. So let's talk about on the way down. So you're set up to do a squat, and on the way down to that bottom position, that's where you first notice some pain. What's going on there? What could be the problem there? The first thing we want to look at is poor sort of motion at the hips. A lot of people, even if they've been exercising for years, really struggle to move well through their hips, to really hinge at their hip when they're doing all sorts of things, squats, deadlifts, lunges, you name it. They don't get the hips moving, so it becomes very knee focused. And yes, the squats are more of a knee dominant type motion, but you still need to get the hips moving, and the glutes have to be big time contributors to the motion. So what should happen? This is a great tool, by the way, to help figure out if you're hinging like you're supposed to with a lot of different movements. Very almost impossible to do with any kind of a load, but just as a general sense and a mechanical thing, what you want, if I hold the stick on my back, it should touch right around my tailbone, right in between my shoulder blades and the back of my head. So when people are very knee-centric, right, what they do is they get their knees going forward this way, and I lose the middle contact point with my back, right? What I should have is something like this, where I keep those 3 contact points as I move. It's a great tool for beginners to learn how to move through their hips without kind of bending and moving their spine all around the place. So most people struggle with a hip hinge. To really get the hips moving, ideally you want the hips and knees kind of working together, but you got to get your butt going back. Sometimes people push it back and then immediately push it back forward. They become very sort of focused on the knees, very little sort of on the hips and the glutes. That's one of the first things. That feeds right into the second problem. Most individuals have very tight ankles. Their ankle mobility is poor. And if I use my hips properly, my ankles have to bend and move a little bit, but I don't ask as much of them as when I push my knees forward. If you have poor ankle mobility, you're going to basically use that up very quickly, and then that feeds into sort of other problems too. So if I go here and it pushes here, I'm going to put a ton of stress at my ankles. Now, ankles and hips are actually kind of linked for different balance strategies in the body. So for some people, once they do this, they automatically kind of get right up into the, into the hips and the low back, as far as kind of like they fold. So it kind of becomes more like this motion. Other times, what people will do when they run out of ankle motion is their heels kind of pop up. So they're able to kind of hold this position okay up top, but their heels are up. Typically, when your heels come up, you get a couple things. A, your ankles, from an anatomical standpoint, are the most unstable when your heels are elevated. The ligaments are most lax. You're most likely to have a lot of movement at the ankle joint. That's one. Two, it's very difficult, damn near impossible, to fire your glutes when your hips are up like this. It's tough to get them to do anything. So now the thing that we wanted you to use in the beginning, you've essentially shut off by getting your knees too far forward. They're not helping like they should. Then the other problem, and all these things feed right up into your low back, is that if you do end up this way, that's one thing. But some people, if they're here, they actually will then fight to do this. So now they excessively arch through the spine, especially the low back, in an attempt to balance their body weight, because toes are up, too much of my weight's going this way. So if I arch my back, I kind of bring myself back to balance myself. It's a horrible strategy, but it's what your body will attempt to do to keep you balanced. Body weight, it's fine, but imagine if you have a bar on your back, right? And now I'm being very dramatic with my motion. You may not be that dramatic, but still, if you're in the bottom position under load and all of a sudden you're getting this, yeah, that's not allowing your spine to absorb that force very well. Instead of it being distributed, it's being focused. And it's going to be focused in the low back. So a lot of this pain that you feel coming down, it starts at the hips. If you get better at hip hinging, it's going to take stress off all the other things. But looking at ankle mobility and other things is not a bad idea, but start with the hip hinge, and obviously start with a lot lighter weight, work on the technique. We'll give you some other strategies in terms of how to do that coming up in the next few videos.